One of my good friends is an attending physician in pediatric dermatology at the Lurie Children's Hospital in Chicago, and she joins us now via Zoom. Dr. Brandi Kenner-Bell. Hey, Brandi.
Thanks, Dr. Ian. It's great to see you.
Good to see you. Welcome to the show, of course. I'm so excited to have you on because I feel like as a parent, which I am also, and you're a parent of two great children, I feel like there's a constant worry about rashes and moles. And we don't know, what should we go to the doctor for, what's an emergency, what's not an emergency. So I want to kind of look at a few cases to give parents kind of the X and O's, the basics of these cases. So let's look at case number one here. Can you describe what we're seeing and how we should look at this?
So this is a picture of a really common childhood rash called eczema, or more formally known as atopic dermatitis. Kids get this red, scaly, itchy patch on the skin that's really actually, like I said, pretty common. The problem is when it's left untreated. And in this second picture you guys can bring up, you can see how kids can become infected on top of their eczema, most often with bacteria. And even worse, in that next picture you'll see, they can become infected with the herpes virus, or the same thing that causes cold sores. This is way more serious because most routine eczema is treated with good dry skin care and topical steroids, and is really well managed that way. But more serious cases are going to need antibiotics or even antivirals.
But you got to do it early, right?
Yes, do not let it get bad. The worse it gets, the more risk.
So you're saying that if you don't treat the eczema, then it makes the child's skin vulnerable to infections on top of that?
Exactly.
Okay, good. Let's go on to our next case. This involves the scalp, so tell us what we're looking at.
So here we see a really common condition known as seborrheic dermatitis. And for those of you who aren't sure what that is, it's really just dandruff, also known as cradle cap when we see it in babies. When this is not too bad, it's more of a nuisance. You get a dry, flaky, sometimes itchy scalp. However, it can look more similar to a condition called tinea capitis, where you get ringworm actually in the scalp. This is a fungal infection where, if left untreated, can become really severe. It can become very inflamed and even lead to hair loss.
So someone who has just dandruff and someone who has ringworm, how do we tell the difference so we know what we should be alarmed about?
Oftentimes, ringworm is going to be very red, very inflamed. Sometimes it can even get swollen. You also can feel sometimes swollen lymph nodes near the ringworm and in the back of the child's neck or behind their ears. And with plain seborrheic dermatitis, oftentimes you don't get that degree of inflammation. Like I said, a mild amount of itching, but nothing too bad.
Okay, and how would you treat the ringworm?
Ringworm you need to treat with oral antifungals. Oral meaning by mouth. It's really important to treat that by mouth.
Right, you just can't let it go. It's not just going to resolve on its own.
No, it would only get worse and worse.